The Mom with Moms podcast is sponsored by Hackensack Meridian Children's Health. Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzeri Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. We are tomorrow is actually the first day of summer. So exciting. I can't wait. We're here in Red Bank continuing our family healthcare series with Hackensack Meridian Children's Health. Welcoming Dr. Victoriya Staab today, a board-certified pediatric surgeon, medical director, pediatric trauma at Hovnanian Children's Hospital at Jersey Shore University Medical Center. Hovnanian Children's Hospital has a robust trauma surgical program, which is actually led by Dr. Staab. Dr. Staab specializes in minimally invasive surgery, congenital anomalies in newborns, and pediatric surgical oncology. As a pediatric surgeon, she collaborates with the pediatric radiologists, pediatric anesthesiologists, and neonatal and pediatric in this one's going to get me intensives. You perform lots of different surgeries. We have like a whole list here of which is great to know. I had no idea that there's so many specialties available at the hospital there. Cancer surgery, chest wall reconstruction, I won't go through all of them, but congenital birth defects, head and neck surgery, laparoscopic hernia repair. I got that one.
Yeah, nice.
Welcome. Thank you so much for joining.
Thank you for having me.
So we've talked probably about surgery on the podcast, I think maybe one other time, but not something that comes up a lot, at least, I'm sure in your world it's pretty prevalent, but it's scary, right, for your child to have to face going through surgery at any age. So tell me, what are some of the reasons that, a child would come to you? I know that trauma is a big one, but what are some questions that parents ask, like from the get-go, either, when they have a little bit more time to prepare for their child's surgery, or if it's trauma-based and it's kind of, your child's going into surgery right now. What are some questions that come up right away?
Yeah, thank you. Thanks for having me. We do kind of have 2 type of practice for our patients. We have the elective ones where you get to know your doctor ahead of time. You can decide if you want to use us for our services. We can sit down in the office setting, discuss all risks, benefits, what's involved. Or we have the hospital side where it's an emergency. There's someone comes in with appendicitis and, you need to take out the appendix, or it could rupture and make them sick. Or you have an injured child that comes in as a trauma activation, and you don't really have time to establish those relationships, and sometimes don't have time to have the full sit-down conversations.
Yeah.
So, we at Jersey Shore Hospital at Hovnanian really pride ourselves on treating the families and the children like they're part of our family. And how would you want your child treated if they're going through the process? I tell families that it's a horribly stressful time whenever your child has to encounter anything in the medical care setting, especially if they need an operation, especially if they need an emergency operation.
Yeah.
So they should be a mess. They should be stressed, and they should be crazy, because they always apologize for being that. I'd be crazy if my child needed to have an operation, and I do this every day. So a lot of times they worry about more so the child going under anesthesia than they actually worry about the actual operation themselves. So we spend a lot of time talking to families about what that looks like, what their involvement in their child coming into the hospital or being around the operating room, and what they will be seeing their child go through as they're going under anesthesia. And then what it looks like as they're coming out of anesthesia. Families want to know about the risks of it. So we oftentimes tell them the statistics that, pediatric anesthesiologists, which we have in our hospital working with us, especially for the little little babies are standing at their jobs, and statistically it's safer to go under anesthesia than be in the car on the ride over to the hospital. So they monitor their child. The families are encouraged to be with their child for as much as we can allow. So that means to be in the preoperative area with them and to actually go into the operating room while the child is going to sleep, especially the little kids that don't get an IV placed while they're awake. So it's a really nice way for a child to go under. So the parent comes in with them. We have child life specialists that come in with the child. They might be playing with them in the preoperative area or watching a show with them on the iPads that they bring, and they carry that into the operating room.
Oh.
The parents come with them, and then the child is, talk to you about what's going to happen. We're going to put a little mask on, you're going to blow up a balloon, and then you're going to fall asleep. And then after they're asleep, the parents escorted out to the family waiting area, and then an IV goes into the child. So it's not traumatizing, and a lot of parents are comforted by that because they've usually seen their child get shots in the pediatrician's office or go for blood work. So it's a calm process for them. And then they are immediately reunited with their children in the recovery room. So we don't have them waiting in the family room. As soon as a child comes out of anesthesia, they get set up in the recovery room, and the family's asked to be there for when their child is waking up. So I think that's very reassuring for parents that their child won't be aware of their absence for the whole process.
Yeah, that's big. So I've only had one surgery in my life, luckily. I was 16 and I was 16 and I had a spinal fusion at Jersey Shore actually, and for scoliosis. And I thought about it a lot because it was a major surgery, right?
Yeah. And
at the time, I don't know if it's just like that fearlessness that you have as like being a teen and just not like thinking about really anything other than like this might stink for a couple months or something.
Right.
Like, it being painful. But now if I had to like experience that, I would be like a mess like thinking about
know too much.
Right?
Right.
So what are so is it the case that like the parents are usually a bit more like of like a bundle of nerves rather than the kid, or does it vary?
Absolutely. The parents are definitely much more stressed than the child. And every once in a while we get a child with has some underlying anxiety, and a lot of times it's helpful for us to know that when their child's coming in, the parents might mention that to the the check-in medical assistant, and then we can kind of use language that might be a little bit more comforting for the child. Like I wouldn't say the word incision. I would kind of talk around exactly what's going to happen when I have the conversation of the informed consent with the parents, exactly what the technical parts of the operation are going to be. But that's kind of an elective setting. In the trauma setting, it's a little bit more fast-paced. The child comes in, acutely injured. Everyone, is brought in usually by ambulance. The parents in our trauma bay are encouraged to be with their child. So the entire process, whenever there's any procedures happening, they're right there to comfort their child. Also, we have child life that's present in the trauma bay. And our trauma team consists of an adult trauma surgeon that's in-house 24/7, and then the pediatric surgeons respond to injured children when they're needed, as well as every subspecialist. So we have pediatric neurosurgery, pediatric orthopedics, we have pediatric anesthesia, all the critical care doctors, a team of nurses. So everyone descends upon the injured child, and it can be really overwhelming. So we really try as the pediatric team to kind of take the family and talk them through what's going to be happening as the child goes through imaging, gets CAT scans, x-rays, blood work. And if they need an operation, it's usually a very fast-paced decision for an injured child because it's usually some bleeding that has to be controlled. So it's a little bit of a different relationship, and we have to establish that trust pretty quickly. But we really pride ourselves on doing that because, like I said, we try to treat them and talk to them and explain things just like our own. We stress the importance of the child being aware of what's going to be happening with an age-appropriate discussion.
Right.
So that they're not scared about the whole process, and at the Children's Hospital, the family stays with the child for their hospitalization. In the ICU, they have a room where they stay in. On the pediatric floor, they have rooms where they stay right with their child. So it's very much family-centered care.
Okay. So tell me, a lot of the times you'll hear parents talk about, oh, I had a bad experience here, or oh, don't, bring them to here for this. And it's confusing, it's confusing to know what's right and know, who to go to, where to go for different scenarios. What makes a trauma center, and why, if your child has been badly injured, why is it important to go to a trauma center versus going to the ER that's like closest to your home?
Well, absolutely. It's a really good question. We work very closely with our paramedics and our EMT colleagues to triage a patient when they respond to an injury. Let's say if there's a car accident, and they will call out to the transfer center, who will be in contact with the surgeon, and they will kind of direct and guide where to go. When a hospital gets the designation as a trauma center, there's a very, very comprehensive list of criteria that the hospital has to meet. So it basically shows a commitment from the hospital, from administration to the clinicians, nurses, techs, everyone, that we have the entire laundry list of check marks that the American College of Surgeons, which designates these levels across the country, saying our hospital has the criteria to descend upon an injured patient and be able to provide everything that might need without having to be transferred somewhere else. So, for example, we have a criteria that you must get to the operating room within 60 minutes of this particular injury, or you must have the interventional radiologist, which is a team of doctors that can stop bleeding using little wires and needles and catheters internally. They have a response time that has to be within 30 minutes. To have a blood transfusion service available immediately. So all of these things that the hospital invests in, and it costs money to put all of these systems in place, the hospital of Jersey Shore is dedicated to make sure that everything that's required to perform the highest level care is there for the child. So if you have the option and a choice between going to a hospital that doesn't have the designation and having a hospital that has the trauma designation, you know that that place will have all the resources that will immediately descend upon an injured patient, so there's no delay in care.
Okay.
We also have quality improvement, that's really important. So we review all of our cases. If there's any delay in anything, if there's ever a misinterpretation of a CAT scan or a delay in an antibiotic being delivered, all those cases get reviewed at our monthly quality meetings, and we have opportunities for continuing to improve our standards.
Wow. Oh, that's really important.
And we also conduct research about our patients that are injured too, which is kind of leads the way in medical education.
Right. So you probably just mentioned some, but what like unique resources that a pediatric trauma center has, like yours has?
Yep. So immediate access to a trauma surgeon that's
Right.
in the building. Sometimes people are on call from home and they'd have to come in, but in our center there's always 24/7 available surgeon in-house, anesthesia in-house, blood bank, radiology, orthopedic services, neurosurgery service, pediatric surgeries, and the specialist pediatric urology if there's a urologic injury. The availability of blood work and pharmacy, labs, techs, everything is in place to be able to take care of a patient, and it all has to be time sensitive.
That's so interesting. Yeah, you don't even think about, because I've been to the ER a few times, and my son was once, and a lot of the time it didn't seem like there was anyone available, and it was kind of just like maybe follow up with someone because that person wasn't there. But you might have the experience where you go and you actually have access to someone who can see you right away, which is great.
Exactly.
I love that.
Exactly. 'Cause some injuries are very time sensitive to address and treat, so we try to make sure that even plastic surgery, ophthalmology, ENT, like you wouldn't even think of all of the different body parts that could be involved. Like a patient comes in with a car accident and injures their face. There's so many components of a face, not only plastic surgery, but ENT and neurosurgery, audiology, everything will be assessed for that patient. So and we coordinate that as the trauma team.
Okay. We talk a lot about the podcast about advocating for your children and listening to your gut, and usually moms know like when their child isn't being treated properly. I probably, not that I took it for granted. My mom listens to every podcast, so didn't take it for granted, but I just grew up in an environment where my mom was a medical professional, so I went through something when I was a kid. It's the vasovagal syncope, and I used to pass out a lot, like a lot. Like in wood shop, I would hit my elbow and it was I was like a mess for a few years.
Yeah.
So back then, like they did like a tilt test, and I was being, if I passed out, sometimes they would just bring me like straight to the nearest hospital, but my mom knew to like have me transferred to a different hospital.
Right.
But I think, many parents wouldn't know to do that, and they're kind of just there like at the mercy of who is treating them.
Right.
So if your child is involved in a trauma, and, would require transferring, how do you facilitate? How do you navigate that?
Yeah, no, that's a really great question because we have lots of Jersey Shore. Hovnanian is the regional level 2 pediatric trauma center. Currently, that's our designation, and we're currently applying for level 1, which is the highest tier. And we respond to calls from multiple other hospitals in the Hackensack Meridian or outside the Hackensack Meridian network, and we'll talk to an emergency room physician and say, I have this child, they fell off their bike, they broke their leg, and they could say, can we transfer? Some of that is initiated by the emergency room doctors because they know that we are a trauma center, and sometimes it's initiated by the family. So if the family is aware that there is a difference, a distinction, and they can actually request from the emergency room doctor to be transferred to Jersey Shore. So they could literally say, can you please, I know you don't have the services here, it's an injured child, they can stabilize them, but I would request transfer to Jersey Shore Hospital. And then they connect them to our team, and then, the ambulance arranges it, and we take care of them when they get here.
Well, oftentimes that happen without how often is it that the parent has to get involved? Maybe it's circumstantial, but where they would actually say this isn't, they would be better suited to be transferred.
Very often.
Okay, good.
Very often. In the region, there's many different hospitals. We kind of are a big umbrella in the Hackensack Meridian network, and we're the tertiary center. That means we have the higher level of services that we can provide, especially for children, because a lot of places don't have a pediatric unit to even admit a child for observation. We get a lot of transfers for belly pain that might be appendicitis. So the families will oftentimes be able to request where they want to go. And all they have to do is, talk to the emergency room doctor, say, well, you don't have a pediatric surgeon to perform my child's appendix removal here. I would like to be transferred to Jersey Shore.
Okay. So it sounds like a lot of the advancements, progression, resources that have been invested into Hackensack Meridian Children's Health, more specifically at Jersey Shore Medical, has changed quite a bit, I'd say, even over the last 5 years. I don't want to say the perception, but the go-to, essentially, for the past 20, 25 years, with any type of escalated incident with a child, oncology, trauma, something that, for you would need a doctor house for, right? It would just automatically go to a different children's hospital in Philadelphia or I think in Mountainside. Is that not so much the case anymore?
Yeah, no, I'm glad you brought that up because I'm so proud of what the evolution at Jersey Shore has happened. I was a medical student rotating here, and then I was a resident rotating here for my training, which was at Robert Wood Johnson. And now I've been on staff here for 8 years. So I've been literally in this network and I've seen the evolution for about 18 years now.
Right.
And the services that are available now were not there when I started my medical training.
Right.
They have invested so much to hire so many specialists here that weren't here before. So we didn't have a pediatric trauma center 5 years ago. We didn't have an oncology robust program like we do. They've hired rheumatologists, nephrologists, dermatologists. So all of the specialists that historically have not been available here, and we've had the reputation, if your child has something complicated, you're going to go to Philadelphia, Children's Hospital Philadelphia. Everyone here who's a parent knows that that's kind of like the mecca in the region. But we've given them a run for their money. I presented a talk there a couple months ago. I presented a trauma case that we had. That was a very interesting case, and it's all the specialists from Children's Hospital of Philadelphia in my field were there. And I described what we performed for this child here, which was kind of heroic, amazing, and beyond the scope of what this hospital's ever done, and impressed all of them. It's not something that's been done to children. It's not something that's really been described. So the growth of the specialist, the investment of specifically the children's line services has really taken it to the higher level. People do not need to leave New Jersey to get the highest level of care for their children anymore.
That's incredible. It's great to know.
Yeah.
It's amazing. I love it.
And we're very transparent. And I always tell the parents, I would keep my child here for this condition.
Okay.
If I feel like something is beyond my comfort and my scope, I have no problem giving directions to Philadelphia.
Okay.
And we have a great partnership there. We have certain transfer agreements. There's very few things that we don't do, but we know what those are and what our limitations are, and we'll collaborate with the doctors in Philadelphia to get the child there if necessary.
Interesting.
But it's very, very rare that we cannot offer the top-notch service line here.
Is that maybe a bit more related to heart health with?
So we do not have a pediatric heart surgery program here. So
Yeah.
that's one of the big limitations. That's very super specialized, and that's not something.
Is Deborah still like known to be?
Yep.
It is.
Yep.
Okay, because
But
that's where I went when I was a
Right,
kid.
right,
Yeah.
right.
Where is that? That's Jersey though.
That's Jersey. Yeah.
Yeah. Okay.
But nothing regional.
But nothing. Yeah.
Yeah.
Yeah. I know. Then there's also like not a. That, but I only know this because my cousin's a pediatric cardiologist. There's not many in New
Right,
Jersey.
exactly.
So yeah, there's a need. So if anyone's listening, and you're in your med school.
And we're kind of a great like catchment area. Like a lot of times people will call our office because there's like, the pediatrician said to call you for this condition. Do you treat this? It's like, well, we might not. We'll take a look. Let's review images. Let's examine your child, and we'll say we'll bring them in and we'll assess together, and then we can direct you where you really need to be. Might not be my area of expertise, but I have a colleague, and in the pediatric world, it's very unique because the communication is phenomenal. So we work very closely with our specialists. If a child came to us with a condition that might need to have a gastroenterologist intimately involved, they're literally down the hall from us. So I'll say, wait right here, I'm going to go talk to my colleague, and then we'll coordinate office visits, we'll coordinate a procedure where the child is under anesthesia, and we can do both parts together to save the child multiple trips. The collaboration is, I think, what makes it so unique in the pediatric world.
That's what Dr. Hidalgo was on a few weeks ago, and he was saying how it's very comparable to Hopkins. Where like the Hope Tower's there, and he can like literally walk down the hall
Yep.
and have a chat about a patient that he saw, and they might not be treated by the same, but he can kind of talk it through, right, with
Right.
whatever the circumstances, which is really unique as well.
Absolutely, yeah. We have GI and pulmonary literally around the corner from our hallway. We have oncology around the corner, nephrology around the corner, and in the building there's also laboratory and radiology services where we have specialized pediatric radiologists, which I think is also important for parents to know about. We have a lot of parents that come to us with a condition electively that might have an ultrasound or a CAT scan done somewhere that's not a facility that has pediatric radiologists, and the reports are just not the same. Looking at images for children is different than adults, and we oftentimes will say, if you can, for this specific condition, go to a place that has a pediatric radiologist on staff, because we're going to get a better quality of reporting and sometimes better quality imaging if they're just used to working with kids.
Interesting. Huh. We have a question in here. What is an injury prevention program?
So part of our trauma designation, part of our trauma protocol and our trauma program is to have injury prevention and outreach to the community. So not only do we treat injured kids, and that's part of our job, we also want to sabotage our own job by not having as many injured children overall in the community. So we have a designated person that is for the adult world and now for the pediatric world to talk about how to prevent your children from getting injured. They go out to various functions. They've gone to different seminars across. They go to the different schools and talk about injury prevention, car seat safety, gun violence safety, all the ways that you can have a child be injured. They are out in the community providing education and resources. How to stop. We have a great program. It's called Stop the Bleed, where our team members will go out to the schools and actually teach them. If you encounter someone who is bleeding out in the street, in the house, how do you actually control that? How do you apply pressure? How do you apply a tourniquet?
Wow.
Teaching people how to save lives.
That's great. On the way here, I was on the phone with a colleague, and her daughter broke her arm over the weekend. And I said, how'd she do it, monkey bars? And she said, yeah. Yep. It wasn't really expecting her to do that, but it was like the most common.
Either that or trampolines.
So, yes, injuries happen all the time. And luckily, she's okay. She's already back at school. It's been like 2 days and stuff, but it's scary,
Absolutely. And, being down at the Jersey Shore in the nice weather, I wanted to kind of put a little plug out for water safety, because unfortunately we do see drownings in our area in the summer months. Every year in our ICU it happens. And, I just wanted to advocate for some safety measures that parents can take for their children. Nothing beats immediate supervision, but it's hard, especially if you have multiples, to keep eyes on the kids. If you go to a place that has a pool, to make sure that the child knows not to go past a pool fenced area without an adult, to make sure that they have swim lessons if there's any possibility that they might have exposure through their life through water. I think it's just so important in this area, to learn how to do proper child safety swimming techniques. Like a lot of people will do the little puddle jumpers, the ones that have the sleeves and stuff, and they're actually really bad for children, and people don't know that because they're sold as this like safety technique, and it gives children a false sense of security, because they'll get thrown into the deep end and they're perfectly fine and floating great, but it actually teaches them to be in the drowning position, which is straight up, because it supports you this way. Or children, as they're learning to swim, should be kind of on a diagonal with the water, so that they can learn to keep their head up. And, so we educate a lot about these things.
How prevalent is dry drowning?
Very rare. We don't see very much of that.
Okay. It's just like a show I watched and it's in my head.
Dr. House.
It was that show at the affair where they lost the son.
It happens, but we don't see too much of that.
Okay. I know you mentioned when children are about to, have surgery it's not so much the actual procedure, but parents get very nervous about the anesthesiology or anesthesiologist. Anesthesiologist.
Anesthesia.
Thank you.
Yep.
I would be too. It can be scary. I've heard stories about, not many, but I do know someone who, 20 years ago, their daughter went under, but was awake during the whole procedure and had all kinds of trauma from it, and had already had a disability, so couldn't. She I think when she woke, she didn't have the ability to tell anyone what had happened.
Wow. I'm sorry to hear that.
So I'm sure that's not. It's very, very rare.
Right.
But I think people do hear stories like this and are scared.
Absolutely.
So.
The conversation I have oftentimes is with the teenage patients, because they've watched these shows,
Okay.
they've watched these movies, and I oftentimes have the conversation in the preoperative area with the teenager, and they're looking very nervous. I'm like, are you scared about going off to sleep? And they're like, they want to be brave. They're almost an adult, but when you kind of pry it out of them, and I'm like, are you afraid that you might wake up in the middle of it? And then they all kind of start to welt up with tears as they try to hold them back in their eyes. And I say, I don't know what movies you guys are watching, but it doesn't happen.
Right.
The technology with anesthesia has gotten so good, and the spiel I give them is, you're going to have the special doctor or nurse anesthetist team that's going to be at the head of the bed, monitoring every part of your safety, monitoring your heart, monitoring your breathing, and I describe it to them as different levels of sleep. I say, how you're starting to fall asleep and you're in a very light daze, and then you go into a really deep sleep. So if you're in a light sleep, you could easily startle. In a deep sleep, it's really hard to wake up. And I said the anesthesiologist can tell how deep of a sleep you're in, and it's newer technology. Also, they can tell their nerve awareness, essentially, and they'll put you in the deepest sleep depending on what we're doing for the surgery. So if you're having a colonoscopy, let's say a procedure that requires a light sedation, so they're in a little twilight, they're not completely under, but when you're doing actually major surgery, you're under complete general anesthesia. And I say that's a really, really deep sleep. And if they sense that your body is going a little bit into a lighter stage of sleep, they'll turn up the continuous anesthesia that's going into their body through an IV, and they'll get them into a deeper sleep. And then I tell them, as soon as I'm finished, I say, I'm wrapping up. They start to turn down the medicine, and they get them to a lighter sleep until they wake up. So they always are afraid of, what if I don't wake up when you're done? So that's the spiel I have with them.
And then they just feel groggy and,
Yep.
and I'm sure, more concentrated on whatever the aftermath from the procedure is.
And then I usually tell them the conversation I'll have with you in the recovery room is, they're going to ask me, well, when are you going to start? And I'm going to say, I'm all done. And they're going to say, no way. And I'm going to say, yes way. And it's the conversation I have with every teenager, because it just feels like 2 seconds for them.
Yeah. Tell me things to prepare parents and children, if they do have a planned surgery and, it's not a trauma, where they have a little time to, talk to them about what the experience is going to be like, and then, what they can expect afterwards. I'm sure it varies because it depends on the procedure.
Sure. I mean, I think that kids these days are very smart. They have access to the internet. They have access to all kinds of information, and I think it's a disservice to try to mask things and hide things, because they know a lot more than they let on. They listen to everything. So I think, to have a full disclosure of what's going to happen with the child with appropriate terminology is really important. Say, you're going to come to the hospital, you're going to have to skip breakfast, you go under this anesthesia, you're going to have a nice deep sleep, and then you wake up, you're going to have this bandage, it's going to be a little sore. Just kind of walk them through what to expect. You might stay overnight in the hospital. We're going to pack your favorite stuffy, we're going to pack your favorite blanket, we're going to get your cozy PJs, and tell them when they're going to eat, because that's really important for people. They want to know, I'm starving, I missed breakfast. So just to kind of walk them through. I think the more prepared they are of what they're going to encounter, the less scary it is, because I think the unknown is what gives the children a lot of anxiety.
Right. Okay. And afterwards, I know you mentioned that you have an outpatient practice. Do they follow up with you oftentimes?
They do.
Okay.
Yep.
Just to find, like, see if it's healed properly, and then they are seen by either specialist and or pediatrician afterwards?
Absolutely, yeah. So it's myself and I have two partners, Dr. McGuire and Dr. Caton, and we have also a team of PAs and nurse practitioners in our group. So depending on what the child's needs are, every child that has surgery gets seen for follow-up in our practice. And then we communicate with the either referring specialist or the pediatrician back to them about what happened. So we send all of our notes, operative reports and the visit notes saying this is what the child had. This is, we had a lump or bump that the pediatrician was concerned about. They sent it to us. And this is our plan. We have the operation. They get a copy of our discussion with the family beforehand, our operative report, and the post-operative visit, which will include any of the results from any biopsies or pathology that was removed from the child. So they have that as all a part of their records. So we close the loop with them. So some people, or it's a one-time encounter and have a nice life, and hopefully they'll never need our services. And then other conditions we follow chronically. We have babies that are born prematurely in the ICU with congenital things, that wiring and plumbing that went wrong in the development that we correct, and we'll follow these kids into their 20s.
Wow.
So, we become very close friends with those type of families.
Interesting.
So get invited to some weddings, the kids as they grow. I keep saying that. I think I'll have a lot of weddings in a couple of years.
Yeah. I think, moms that are listening, to be able to bookmark different surgeries that you do perform. If maybe we could just go through like a list, so that way, maybe it's not in the near future, but moms will remember, that I can, my child can be seen here for X surgery.
Yeah. Well, first of all, we're happy to take phone calls and say, do you guys treat this?
Okay.
Sometimes even the pediatricians might not know who does what.
Okay.
So like I said, we're a catchment area. We're general pediatric surgeons, which is kind of a dying breed in the adult world to actually be a generalist, which means you do a little bit of everything. So our bread and butter is general surgery inside the belly. So appendicitis and hernia repairs, lumps and bumps, skin infections. That's kind of like the most common things that we see, all different types of hernias. And we do minimally invasive surgery, so laparoscopic and robotic surgery we offer. Robotics is the only center in the state that does pediatric robotic surgery for general surgery for kids.
Is appendicitis very prevalent with children?
Yes.
It is.
It is the most common thing that keeps me up every night.
Okay. Interesting. All right.
Yeah, so we do a lot of that, and then we do more specialized surgery, and I could create a laundry list, but it would take all day, but basically the only thing we don't do is brain, heart, and bones. So we do surgery on the lungs, on the esophagus. We do some plastic surgery work. We also we partner with our plastic surgery colleagues and do combined cases if we need something a little bit more specialized. We have a craniofacial clinic that deals with all kinds of complex reconstructions for children that is run by a plastic surgeon that does pediatrics and a pediatric neurosurgeon. So we sometimes will do combined cases with them. We will do surgery. We can do surgery on the thyroid. We combine cases with our adult endocrine surgeon, so we can team together. Bariatric surgeon, I know we had Dr. Hovnanian on here, so we will partner with her for operating on children with complex minimally invasive surgeries, and her team. And then we can do some urology and some gynecology. There are specialists of that in the hospital as well, but sometimes they come to us and there's some overlap there. So pretty much skin conditions, soft tissue conditions, anything in the belly. We do cancer surgery, and we do trauma surgery, and we do congenital anomalies in children. And the minimally invasive is kind of a passion. It's the move forward with doing complex things inside the body, and having little tiny scars where people ask, like, no, you didn't have surgery. Where are your incisions? So it's kind of the pride of our practice.
Okay.
To do a good job and make it look invisible.
I like that. I wish we could go back 25 years. I have like a giant scar up and down my spine.
Yep. And we talk about a lot of scar management after you're done too.
I didn't do any.
Office.
I sat in the sun. There was nothing. We just read 17 magazine and put oil on our bodies.
Yep,
it was a great time.
It was a good time.
And sun in.
Yeah, absolutely.
Is Dr. McGuire your partner, Dr. Margaret?
Yes, Dr. Margaret McGuire, yes.
We just featured, we have through the partnership with Hackensack Meridian, we have do something each month called Meet a Doc. So
nice.
this morning, it's like an interview to get to know the doctor,
perfect.
the person behind the MD, essentially.
Nice.
And monthly, so we just featured her this morning, which is funny that you mentioned that.
Yep,
so,
yep.
Yeah,
It's
so
me,
that's
Dr.
her.
McGuire, and Dr. Mark Hayton, who is he's the chief of our practice.
Okay.
So the three of us.
Great.
Yeah.
Well, thank you so much for coming on. This is so interesting to learn. I had no idea about a lot of these resources available right in our backyard, and I'm sure that lots of moms are happy to know it too, right? That you don't
My
have to
pleasure.
go too far to have your child's needs met, which is so important.
Absolutely. I love following you guys on social media, and every once in a while someone will post about a health condition, and I'll private message you and I can kind of hook them into someone, whether or not it's a colleague that, we can get a quicker referral, or, they're like, they don't know, they're at their wit's end, they don't know what to do, who to see. So yes, I'm always happy to have someone reach out in the office, and we're very quick about getting patients in. We can have either a same day or next day appointment for something urgent is needed. So.
Okay. And we had mentioned before we sat down, you're a mom too, of two, right?
I am. Mm-hmm.
And Monmouth County mom, which is great. So thank you for coming on and sharing your story and sharing what you can help all of our families with in our community.
Thank you so much.
Where can everyone find you?
So they can call our office at 732-935-0407, or if they want to look through the Hackensack Meridian website, they can find us on searching for pediatric surgeon and find our website.
And we'll put all of that in the notes here too. So if you need to look it up, it'll be right directly in the program notes there. So
thank you so much for having me. This was
thank
great.
you for coming, and enjoy your day, everyone. Thanks for listening.